Welcome. Thank you all for being here today as we kick off our Autism Acceptance Speaker Series. We're very excited today to talk about the latest trends and research in autism. There's been some data that has come out that I think is really interesting that we want to be able to share and increase the dialogue and conversation about what we do here at Family Initiative and really understanding. We're super thrilled to have Haley Moss with us, who will be speaking in the second hour about her own unique perspectives about autism and being a female. So we're really excited about that. But to start with, I really wanted to talk about autism. When Dave and I started the organization about 10 years ago, I'm just going to keep going, even if they can't hear. I'm not sure what to do at this point, so we will just keep going. But when we started the organization about 10 years ago, people didn't really know what autism was or what it looked like. And I think we have learned and we have seen an increase in the conversation and the dialogue about that. So to start with, we want to talk about what autism is and how it was diagnosed. So the original diagnosis started in 1943. So I think he was a doctor, Leo Kanner, published a paper called The Autistic Disturbances of Affective Contact. And really that's posited as the discovery of the diagnosis. And so what he did was he worked for Johns Hopkins and had about 11 young people, kids, come to him between the ages of 3 and 8 years old. And there were 8 boys and 3 girls. And back at that point, a lot of the conversation was really about childhood schizophrenia. That's what they were comparing it to. That was the more popular diagnosis. But what he started to see that was different was this pattern that emerged with those 11 children that was consistent and different from those other diagnoses. So they really focused on objects. This is what he says. They were mesmerized by objects, but indifferent to people. They had difficulties in infancy, particularly with feeding. They reacted fearfully to loud sounds and preferred rigid and repetitive routines over any kind of novelty. He also said that they appeared detached, so there wasn't much interest in other people. And he really felt like there was an obsessive desire for keeping things the same, maintenance for sameness. He said they also had, they preferred objects over people and engaged in rhythmic behaviors like spinning, jumping, rolling, and had other unusual body movements. So this is his language. They also engaged in unique linguistic behavior, so echolalia, regressions in speech and language, and had hyper-focused interest. So this is what he saw across the board with those 11 children, published that paper. And if you look at, so currently today, what we use is the DSM-5 TR, is the Diagnostic and Statistical Manual. That is for every diagnosis. And when you look at the diagnosis for autism, you see all these characteristics. So right now, today, for a child getting an autism diagnosis, their criteria are the persistent deficits in social communication and interaction, which is exactly what we're seeing, right, in what Leo Kanner said. Restricted and repetitive patterns of behavior and in specific interests and activities. So again, what is in what he shared. Right now it talks about those symptoms being present early on and that the symptoms cause clinically significant impairment in some domain of life. So you see how, when we start with that, where that definition was and kind of where we are today, how currently and over the years autism is being diagnosed based on, 80 years ago, right? I can't do math. A long time ago of observations of 11 children. So after Leo Kanner, there was a lot of folks who came out after that. So Hans Asperger's was the next year, who kind of talked about similar characteristics, but in a different level of intensity. And there's been a lot more focus and insight on this. So as we've seen changes in autism over the years too, in terms of prevalence. So we'll talk about, I got my clicker. Sorry, I was gonna move the other way. It's on the end of 71. I can't get the, there we go. So we'll look at the prevalence of the data. So if we look at the prevalence in 2000, the Children's Health Act of 2000 authorized the Centers for Disease Control to create the Autism and Developmental Disabilities Monitoring Network. So the data that we have currently, that we talk about, that we look at when we're talking about prevalence, is from the ADDM network. So that's where we're getting all this data. So they have been tracking data since the year 2000, when that act was passed, at specific sites around the country. So there's been as few as 6 sites. So when they first started, there were 6 sites across the country. Tasmania has 14 sites. So in 2008, that's when we had the most number of sites. We had 14 sites. But since 2010, there's only been 11 sites that they collect data on. So what they do is they look at how many 4-year-olds and how many 8-year-olds are diagnosed in those particular sites. And we can get you a list of the different sites. There's not one in Florida. There was, when we had 14, there actually was a site in Florida, but there's no longer one in Florida. But they're kind of scattered throughout the country. So they look at 4 and 8-year-olds, and they look at their diagnosis based on state and community health providers. So any of those state-funded or community health providers, early intervention providers, which they didn't quite define. So I'm not sure if those are private or state-funded ones, and school districts. So you all know, and we talk a lot about, there's a difference between school-based diagnoses and medical diagnoses. So you can have an exceptionality through the school district of autism, which is separate from your medical diagnosis. So they do a pretty robust look at that. So they're looking at all those different diagnoses of 4-year-olds and 8-year-olds, because they really want to get that, that information. And what we can see is over the years, so 2000 is when they started this. So you can see the prevalence was 1 in 150 back then, and then just a steady increase. So if you look at it, this is the data, why it says like for the most current is 2020, where we're now 1 in 36. What that data is actually, it was reported just in 2023, but that data is from 2020. So it takes them a couple of years to gather all the data, interpret all the data, and then report out on it. So you can see for all of the data on the graph here, there's a year that it was reported, and then there's a year that you're seeing on the axis there is the year that the data is actually from. So, I mean, that was in 2020 where we're seeing 1 in 36. You see the trend that's occurring. So there's a lot of dialogue and discussion about the current prevalence might actually be higher, because now we're in 2025, right? So, and you see, oh, I have my clicker. You see here, like this is where the year reported, and this is the actual year of the data, this 2020, 2018. So every couple of years, they're coming out with updated prevalence and data. So what we saw through all this data from the CDC and the Autism and Developmental Disabilities Monitoring Network is that historically, what we've seen is the autism spectrum diagnosis is 4 times more likely in males than females. And think again, when we look at that original diagnostic criteria, the ratios were much higher for males in what he was observing than females. And what we talk about is for current diagnoses, when we're looking at this data, that it occurs across all races, all ethnicities, and all socioeconomic statuses. So in all this data that we're seeing here, there is 1 in 4, right, males and females, and that is across all people. So, and there's been other data that's not international that always also looks at these trends that models this. Like it is the same, more prevalent in boys, that it is across the world that they're seeing the similar patterns and rates of behavior. Some of it might be a little bit different just because of how they're collecting the data and the awareness and all that in different countries, but definitely the trends that we're seeing here are being mirrored internationally. So in this 2023 report, so this most recent data that we have available to us, that 1 in 36, is where we start to see some changes in some of the data, where some of those things start to get teased apart. So what we see in that is, I wonder if I can do this, nope. What we see, I'm just gonna do this because I know how to do that. Is we start to see that 4-year-olds born in 2016 are 1.6 times more likely to get a diagnosis than those born in 2012. Okay, so when we're seeing this, so now we're seeing bigger trends. So even though, so when we say 4-year-olds born in 2016, so that data would have been reported in 2020, right? When they're 4 is 2020. So you're seeing that increase in 4-year-olds now. And keep in mind, so 2020 is when we had COVID. So there are actually less evaluations and assessments being done in the year 2020, but we're seeing higher, much higher, 1.5 times more diagnoses in that age range. And also with the graphs you see, it's a little bit hard, I'll talk about it in a second. We're also seeing 8-year-olds are continuing to increase in the number of children diagnosed. So this is a cumulative graph. So what you can see is, so this is 4-year-olds, the yellow line here. So the line going up and down is 4 years old. This is your 8-year-old map. So you can see cumulative diagnoses. It just continues to go up and up and up. And you can see that trajectory for the 4-year-olds is a little steeper than this one, which is a little slower climb. But you're seeing increases in both. So we're definitely seeing more diagnoses happening at a younger age. The other thing that we're seeing at this point, for the first time in this data that was reported in 2023, is the percentage of Black, Hispanic, and Asian and Pacific Islander children identified with autism is higher than that of 8-year-old white children. So if we look at, I'm gonna do this again. I'm gonna explain this graph because it's a very wonky graph, so I'll explain what we're seeing here. So the first thing you'll see is the increasing trend. What we're doing is breaking it down by ethnicity and race. So this right here will tell you. So the yellow gold one is white, the purpley color is Black, light blue is Hispanic, and green is Asian or Pacific Islander. So the circle in the middle is like the number, right? That's your, I'm going to use simple language. It's the number, the main number that we look at. These lines that go up and down is basically like how confident are we in that number is correct. So there's a little bit of variability potentially. So when you have lines like this, like here, everything's kind of overlapping. Like this line encompasses all these dots. So there's not a significant difference between these different numbers here when we're looking here. And even here, I mean, you see that here white children are higher than the other. Here it's kind of overlapping. Here again, white children are higher significantly, like none of the lines are overlapping. Here we start to see it get closer. Here we start to see bigger variability. So we'll look at this most recent data and you see this is it right here. So you can see children who are white are much lower than these other ethnicities in the data. This is the first time since they've started taking this data in 20 years that we're starting, 25 years, just kidding, that we're starting to see this difference, right? So it's super interesting, I think, for us to look at this and why this is happening. So the other thing through this data that's not reflected in the graphs here is the number of girls are being diagnosed at a higher rate as well. So before the percentage was fairly low, but that number is also increasing for females being diagnosed. And so part of the discussion is this because there's more understanding, there's more outreach to some of the underserved communities? Is there more awareness? There's definitely more screening. So this has definitely been integrated into pediatric visits where doctors are asking about these and doing earlier screenings. There's definitely more awareness. But does that account for this variability we're seeing in here? That still remains to be answered. But we're definitely paying more attention to it and seeing a lot more of it, again, for the first time since we've ever been taking data. So yes. Oh, thank you.
I had a quick question. Yeah. I've been out in the community and I've been hearing in Florida it's 1 in 6. And just wondered if you have any data or will be speaking about that, or if that's based off of the foundation of a different study.
That is likely based off the foundation of a different study because the CDC and this other data I'm about to present, neither of those sites are in Florida. So depending on where and how that data was collected, I'm not sure, but we can definitely have a conversation about that because I'd love to learn more about that too. So yeah, it is getting the prevalence of autism is a challenge because there's lots of different ways, like we talked about, whether it's educational record, public health, private insurers. So it's being able to accurately obtain all that information can be challenging. So I think we use these sites and data as as trends. And there's absolutely differences in different regional areas. So if you look closer at that CDC data, they go into a deeper dive in each of those sites that they have. How many did I say? 8 right now. So each of those sites, 11 right now. So they look at deeper into those, and some of the sites might have slightly higher, some might have slightly lower. So I can definitely share that reference with you afterwards and talk more about that. So, but it is something I think we here at Family Initiative are constantly trying to unlock. How do we get accurate data? What I can tell you is I know we've seen an increase in the number of families we are serving by a significant amount since we started. And again, I don't know if that's just because of the awareness and understanding. It's also in the way the diagnosis is being made. So historically, I talked about the DSM, it was autism spectrum, or autism, not autism spectrum disorder, it was autism, and then they had like pervasive developmental disability and Asperger's, and in 2015 when the DSM came out with their revisions, they actually expanded it to autism spectrum disorder. So it did become a wider umbrella, so it encompassed some of those other diagnoses. So there's lots of different factors that we can look at that might influence those numbers. I think what we're again talking about are the trends. So we talked about the CDC data. We also have this data, which we're going to talk about, which is from a Kaiser Permanente study. So Kaiser Permanente is private insurance, right? They did this study that was funded by the National Institutes for Mental Health. So this data is from 2011 to 2022, and they had 12 sites across the US. They only had 3 areas that were in common with the CDC data. So California, Minnesota, and Georgia were the only common ones. Everyone else, there were different sites. So 7 or 8 of the sites were different sites throughout the country. And they had over 12 million families that they looked at, or individuals that they looked at. And they looked at birth through mid-60s. So they had a very wide age range. And so over 12 million in that time. And basically what you see here is a similar trend. So you see that increase. So the dots are just their 12 different sites, so that's a lot to look at. But if you just look at the overall trend, you see again an increase. So this on this axis is the diagnosis rate per 1,000 individuals enrolled. So out of all their 12 million people that they served in that 11 years, this is the rate of autism diagnosis in those different sites. So just like you asked, so you can see in the sites there are definitely differences. But you see in all of them, there's that increasing trend over that decade. So they're definitely seeing the similar pattern. So here, among their full study, the sample of children and adults, they saw rates rising from 2.3 in 1,000 in 2011 when they first started to 6.3 per 1,000 in 2022. So in that, just over a decade, from 2.3 to 6.3. Per 1,000 individuals being diagnosed. So again, a significant increase. And what they saw here is similar to the last graph I showed you. The rate was highest amongst 5 to 8-year-olds in that study period. So we're seeing that being the highest diagnosed age range is those elementary age, I'd say like early to mid elementary ages when we're seeing more diagnoses. So we're definitely seeing the similar trends in a whole different set of data, which is always interesting. The other thing that we saw that was interesting in this data is the greatest increase in the diagnosis rate occurred among 26 to 34-year-olds at 450% over 11 years. So now we're starting to see more young adults getting diagnosed, which anecdotally we're seeing here as well, that we are definitely getting more individuals of all age ranges, younger as well as adults and young adults being diagnosed. And the national data is reflecting that by a significant amount. So, and again, same thing, the diagnosis rate increases were greater for female children than male children. So in female children, that increase was 300, in females, it was 305% the increase. In males, it was only 185. Which is still a really big number, don't get me wrong, but that's a big difference. For males, 185%, for females, 305%. So you're seeing these same trends, so many more females being diagnosed than males. We also see, hold on, let me switch to this. I'm gonna go through this in a second. the autism diagnoses in adult women jump more than 300% too in between that 10-year time span. So this graph is same trends we saw in the CDC data. So this is by race and ethnicity. So I have my clicker here. So over the years, we're seeing the same increasing trend. So this is for children. We're seeing, it's on here, we see the highest level is an American Indian or Alaskan Native, but then followed by Black or African American. And then this one is Asian right underneath that. This is white children, this is other, and this is Hawaiian or Pacific Islander. So similar trends that you're seeing a discrimination or a distinction in race. And this is ethnicity, so Hispanic is the orange, non-Hispanic is the gray color. So you start to see a difference here too, when historically it has been Hispanic has been lower and non-Hispanic has been higher. So until this year. This second side is with adults. So this is some of the first data we're seeing for adults diagnosed with autism when we're breaking it down by race and ethnicity. And again, you see a higher level of American Indian or Alaskan Native, which we will absolutely look more into because that is this trend unique to this data from this study. But you're also seeing those similar trends here. Still, white individuals are the highest diagnosed, but all those trends are increasing, and you start to see this orange one, Black and, or African American, is some years higher and some years right at it. So again, we're seeing those increasing trends across that, and same here. Oh, I'm way off. Non-Hispanic is top one, and Hispanic. So those trends aren't as prominent in adults, but we're definitely seeing that same trend in in children. And part of it is, like we just talked about, the number of children is much higher than the number of young adults that we're seeing here. So any questions about that super wonky graphs? All right, I'm going to go on to the next one. So this is our data about females and males. So this is your ratio. So this number is the ratio, male to female ratio prevalence. So 1 would be equal. If we were on this line here, that'd be for every 1 male, there's 1 female diagnosed. Your gray line, gray circles are adults. Your whatever color this is, orange, are children. So you can see this is when we're saying 1 female to every 4 to 1, right? You start to see that decreasing trend where it's coming closer together by over 1 point. So over a decade, we're starting to see those numbers get closer and closer together. And same with adults. So this is your adults. So you're starting to see those trends get closer and closer together. So a lot of what we talk about here is we're starting to see doctors, clinicians recognizing the signs and symptoms in females. And I think when you look at that original data, when you look at those 11 children, we had 3 girls in that data set. The manifestations of behaviors of those 3 girls were pretty significant. So their delays were significant. They were nonverbal. They were cognitively. There was a lot of. Is much more severe, I would say, or much more impacted than what we are talking about. When we've increased the diagnostic criteria and we've been more open to looking at those patterns and trends, we're starting to see that. This data from the Kaiser Permanente study is the first time that we're showing that the ratio for male to females is now 3 to 1. So again, we are definitely seeing that increase and change. So it's the first time that we've seen that ratio from 4 to 1 to go to 3 to 1. So there's definitely an increasing trend. Or are we just better capturing that? I think that's what we always want to look at is there a change in the data, or are we just getting better at identifying and understanding? I think for us, the key takeaways from the data are this. So the prevalence across our country is continuing to increase. Yes, it's specific sites, but between those two, I can't do the math, it's like 20 different sites, right, across the country that we're getting similar trends where it's increasing variability. And we're definitely seeing those changes across all ages. Same thing, we're seeing those differences in race and ethnicity, and we're starting to see that gap between males and females getting closer. So I think for us, what we're looking at is, so what does that mean? Yes, there's definitely more awareness and understanding. So I know in the work we do, and we probably have a unique lens because this is all we do all day, but there's definitely more families that we're reaching out to. When we started here in 2015 is when we started. I mean, we were literally serving probably like 6 to 10 families that first year. Last year in 2024, we served over 3,100 families. So that's a lot of families and a lot of increase that we've seen. I know across our programs and services, the number of children that we have served has increased, but we have also expanded our access. So from babies, we do the free screenings and baby ME program all the way to our young adult programming. So we are expanding the range as well to match the needs that come in. So for us, as we continue to see those needs, I think we're continuing to build programming about it regardless of what the data say. I think for us, if that's what families are saying, we want to be responsive to those needs and to those wants. And I'm grateful for our board and the families who work alongside of us and advocate for those, because really what we want to do is, regardless of what the numbers are, is making sure we're being available and helping families. I do think when we look at the differences between males and females or ages, are there things we have to do differently? So when we talk about the difference in females, a lot of the conversation that you hear out there is, and I will defer to Haley when she speaks as well, is are there differences due to the way females are, right? The way we manifest. So I'm not talking autism. Let's just talk generally about males and females. And I can only speak to a female perspective. So, but there are the way society views females and the expectations for behaviors and cultural norms and societal norms are different. So a lot of the conversation for females is about, are they just better at masking some of those feelings and emotions? So maybe the behaviors and that would qualify for a diagnosis are still occurring, but are females masking that? So they're not showing those behaviors, or are they being explained a different way potentially? And I think that's a lot of the conversation. So what do we need to do, Family Initiative as a provider and us as a community, to better understand that and have that dialogue? And I think this is the first step in that dialogue, and why we wanted to talk about this data, because I think we want to be representative of the families we serve, but we want to understand better the families we serve too, and figure out what are those things, and are there different ways we should build our programs and our services and all the things we do to better make sure we're capturing and understanding and really truly supporting young ladies and all ladies who are on the spectrum. So I think that's really it for us and what we do, and we're continuing to build and grow the things. One of the things we know we are doing is starting this summer after school gets out. We're going to launch a girls group, so we really want to focus on young women and girls. So for lots of reasons. I mean, I think this is how for a lot of reasons, the programs we started, like our teen group. Being a teenager is tough. Growing up is not easy, right? So no matter what, it is tough. So what can we do to wrap our kids and our families around support? So understanding that in each unique way, how can we better wrap our support around young ladies, and what else can we do? So we're really excited to kick off that group, and I can't tell you the details because we will respond to what families want. So I know there's a lot of people in here who have young ladies in their homes, so I'm sure we can talk more about what that looks like and what age range and all that. But I know this has been a conversation we've been talking about, so we're very excited to launch that. So I think that's where we are. I don't know if there's any questions.